for years, I was experiencing excruciating anterior pain, like radiating from the anterior part of my shoulder all the way down through my bicep. So I'm a professional bodybuilder and also a power lifter. So you can imagine, I mean, there were times the pain was so intense. I mean, I would have tears in my eyes. I mean, I could get through it, but there comes a point where, I mean, I couldn't do the things that I like to do, and I wanted to be less and less in the gym. And I felt like, God, you know, what's my next step? Either I'm going to have to do this surgically, which had been a thought, or I thought I would try something different. And I had done some research on a therapy called PRP. And I actually heard about you from a friend of mine who you came as a strong referral from a friend of mine in Connecticut, actually. Funny enough. And I'm like, well, I live in New York, so I want to take advantage of this and see if this could help me. So for me, the worst part is taking my blood. But, you know, that never goes well. But once we got all the blood, so what they do, you know, obviously you come in, you're drawing your own blood. And I think we took a lot. It felt like it was well over, well over 60 cc's. I know it was a lot. And once you get that done, I know you spin it down and you're removing the red blood cells and you're left with this beautiful plasma, this plasma-rich platelets, right? So I was fine. So basically, I had my shoulder, and you were able to inject in the areas which were causing me the most discomfort, which was that bicep tendon, really, in more than anything else. And it didn't really, to me, it wasn't anything you couldn't handle. I believe we did lidocaine in the area, so I really didn't feel much. It was a little bit of pressure, so it was something that was completely tolerable. So when I left, I mean, the next couple of days, remember you warned me, it feels, I mean, it feels very heavy, very stiff. Reaching up wasn't the easiest thing, and then it just gradually got better and better. So I took a few weeks off the gym, so I was just doing mostly legs. I really wanted to give it a chance to work and do what it needed to do. And then, I remember getting back in the gym and just, easing my way back, and then it just felt better. I mean, and it just felt like it continued to get better. That was, which was, I'm telling you, it would radiate. I would carry groceries, and I'm a strong girl, and it would hurt. You know what I mean? And then I don't feel that anymore. And it's been 2 years since the procedure. And honestly, I mean, I was sending my friends. I've been just try this. Before you get under the knife, before you have surgery, before you go those routes, try this. Because I do believe in it. I mean, I believe that what it can do. I mean, here's this. For me, look, I have a lot of problems. I've been lifting since I was like 14 years old, and I'm 42. So I know that I have arthritic damage. I know this. I've had MRIs. I have imaging studies. I know that there's some arthritic changes that I can't, obviously, I mean, I won't be able to ultimately change, but in terms of pain, I'm not in any pain. I can lift again. I was lifting back when I saw you 2 years ago. The most I was doing is around 60 pound dumbbells. I did this past year 105-pound dumbbell presses. I mean, you know what I mean? And I didn't get any younger. So I got older in the 2 years. And I'm lifting at pretty much one of my, truthfully, like it's some of the best that I've lifted in many years, So for me, it's really been an amazing success.